Hello everyone, this is Raven. This is going to be the introduction. I'm actually filming this after part one. I wanted to clarify the actual purpose of the whole video. Raven here, beautiful German Shepherd. She has been mine for 7 years. Incredibly good girl, dealing with some hip arthritis. So the goal of these videos is just going to be to talk a little bit about dog specific massage and manual therapy techniques, especially in dealing with the most common issue that I tend to see, which is hip arthritis. She recently started displaying some more concrete signs of the arthritis, developing into a little bit more of an acute phase. So, Ben yesterday played with just some assessment and got the results I was expecting and looking for. So wanted to catalog this as a hopeful teaching tool. So the next parts will be, there's the part one after this where I talk a little bit about her story and certain things of just, what to think about in relation to just mammal anatomy stuff, commonalities, like anything. Get a good resource guide and look at the anatomy in order to learn it better, learn the behaviors of the animals that you're dealing with so that you can be safe. And if not your animal, always have the owner present, of course. So then in the second part, which will be, there's going to be 3 key videos here. I'll actually show the manual and movement-based therapies that I do with her, usually post the exercise dynamic. You could stagger these things into some like prehab and then the actual exercise-based movements and exercises, and then post-exercise doing more therapy. So just like in thinking with physical therapy, there may be some work we could do before doing some exercise that would limit the stress on let's say the joint in question, the hip, thus allowing for the muscles that we want to strengthen in the exercise phase to be strengthened a bit more effectively. If something is acute and the movement is disturbed, and then we go into an exercise and strengthening pattern, we may inevitably not only, worst case, put the joint into a compromised position, but strengthen these muscles in a guarding reflex that we could make potentially more and more chronic. So, like anything, the more acute it is, the less we do, the more it is about just pain management, etc. And then there will be another video I will do that is specific to the exercises. I did 2 rounds of manual therapy yesterday. One more assessment based, then went out and did some exercises, then afterward did some more intervention based manual therapy and got the effect and response that I was looking for, above what I was really actually expecting. So I'm very confident that I am on the right track. So anyhow, welcome to German Shepherd Massage. She is a shy little creature. And I hope that you enjoy what you see. She is adorable, much more adorable than me, but I am very lucky to have this one. And I'm just really wanting to challenge myself to think about the skill set that I have as a massage therapist and apply it to helping her maintain the movement and lifestyle that she's had for as long as possible. And so there's multiple factors to consider with that, whether it be, managing a healthy weight, which she's pretty good, but she's just a big dog in general. And then, I've had to think about managing, the exercise, no running on pavement, think about duration and intensity, as she's gotten older, for example, you know, when it's really super hot out, maybe not then, she handles the cold wonderful, but the cold also seemed to exaggerate the arthritis when she was more sedentary. But the cold and the snow acting as some resistance, that's wonderful. Moving forward, I believe that water will be a wonderful way to still get her good exercise while limiting the stress on the joints. So lots of options there. The key thing that I feel a touch guilty about, and I just want to make sure I continue to do very regularly for her, is to incorporate just some mild manual therapy and massage therapy techniques to help sustain and maintain the health of her joints as much as possible. Maintenance and prevention, the best thing we can ever hope for. The problem with that is we can never prove what we prevented, right? So, positive intention. We're going to keep this rolling, and as long as I continue to see her respond as well as she did even from yesterday, that's the big thing. Let's hope that it all presents while I'm filming as well as it did in the moment when it was just the two of us. So, welcome again, and off and away we go. And if I didn't say before, I don't think I did. I am Luke Fritz with Health Enrichment Center School of Therapeutic Massage, and this will be a fun little experiment that she and I will undertake together. So, on to the next one. I will see you there.